Hello and welcome to my channel. I'm Rebecca and I am back with another self-massage video. If you haven't seen the other videos in this series, definitely check those out because they could be really helpful for you. Today we're going to focus on knee pain. And this is the kind of knee pain that you get a lot when you're running or biking. Now there are many reasons that you could have knee pain and we're going to focus on the muscular reason. Now muscle tension can cause severe pain to where you think that your knee might be popping out of place. I've experienced that pain on my way to take a run. I hadn't even started to run yet. I was literally walking out of my door onto the sidewalk and my knee just like locked up. It felt like if I took a step, it was going to break in half. And so I just stopped, I stretched it, took another step, same thing. I was like, oh no, I have to run. Like I'm starting to run and I have to run. I can't let anything stop me. So then I did the same technique that I'm going to show you today. Then I stretched it, and then I was able to run a whole mile without any knee pain. So this is something that can really help you if you have severe knee pain. But always check with your doctor to make sure nothing serious is going on. And also, there are other muscles that can contribute to this that you may not be able to get to yourself. So I totally recommend seeing a qualified professional. And in fact, I will leave a link in the description to where you can find a qualified massage therapist in your area that can help you with this. So let's move to the floor and get started with the technique. Working the quads, which is this huge muscle group right here, there can be pain on the middle of your knee from the vastus medialis. There can be pain on the lateral side from the vastus lateralis, and this is a huge muscle here on the side. And then you could also have pain on the anterior part of your knee going down below your knee that comes from the rectus femoris. If something persists, you want to check to make sure there isn't anything seriously wrong, but even if you've had pain for 9 years, it may still be caused from soft tissue. To get yourself in the best position, I recommend just sitting your back against the couch where you're comfortable, and you want this muscle to be in a relaxed position that is shorter. You do not want it to be stretched. Its job is to extend the knee and flex the thigh, so you want to be in that position just so it's pliable. You don't want it to be overly stretched or you're not going to be able to work it. Now, you can work the trigger points in this muscle and you can work just the muscle tissue itself, because the muscle tissue can just become restricted from all the muscle fibers sticking together, and there also can be trigger points in the muscle that can refer pain. So first, let's just work the tissue. The first step in all of my self-massage is to just warm up the tissue. So you want to just gently kind of press into the muscle, do some circles, do a little bit of kneading, like you're kneading some bread, and just soften it up. You're just trying to warm up the tissue to make it more pliable. And honestly, sometimes this is all you really need to make yourself feel better. It's just warming it up and loosening up those fibers. Now, the next step is to then search. You want to search for any spot that feels tight or tender. Now there is a difference between what's tight and what's taut. So you can feel something that feels hard. If you press on something that's hard and it doesn't release after a minute, most likely it could be taut. Now if you're in this position, none of this should be taut, and what I mean by taut is that it's on a stretch. But when you're working on different areas, just something to notice and keep in mind that just because it feels tight does not mean it actually needs worked on. It could be something else pulling on it, making it tight. So it may not be the actual muscle itself is tight and restricted. So we're just going to work around right above the kneecap, and we are working on the vastus lateralis right here. And you're just going to kind of sift and search. And if you come across something, this is the area that I worked on when I had the really terrible knee pain. And you just can hold it until it releases. You can also do some friction. Now this muscle runs in this direction, so we're going to go with the fibers. Now if it was scar tissue or if we're working the tendon, you would want to go the opposite direction. But we're working the muscle belly right now. And you can just follow it along your leg, and at any point there could be a tender spot. So that kind of feels tender. You can hold it. You can do some circular friction. You can do just some friction with the fibers. And you can just search and sift and just go all the way up. Now, a big trigger point for this muscle is actually located just a couple inches below your hip bone here. So right where your crease is, maybe a few fingers down, and it's different depending on your size and everything. But you can feel, and if you have a trigger point, it will feel very tender and it will refer pain down your leg or even into the back. Right here is actually where I'm feeling it. So it might be on TFL a little bit, but either way, it doesn't matter what muscle you're doing, because if you feel something, then just hang out there and allow it to release. And that's what you do for trigger points. You want to hold them for about 30 seconds. And you don't want to press really hard. You want to press enough to get the reaction, but you don't want to press too hard, because if you're pressing too hard, your body will rebound and it will basically tighten up and seize up and won't allow it to release. So you want to ease in gently but firm, just like when you're talking to your kid. You know, you don't want to scream at them, but you want to be very stern with them and tell them who the boss is. That's what you're going to do with your muscle. You're going to be gentle but firm. Now, after you do that, then you can stretch out the muscle. And to stretch this muscle out, you know, just simply bend like this, and you can see that it's stretching. You can even press your hip up a little bit to get more of the stretch right here. That's a simple way to stretch while you're in a seated position. Also, just standing and moving your leg, you know, bending your knee and touching your booty with your heel is another great way. Now, my recommendation is to do this process about 3 times, depending on how bad it is and how many spots that you find, and you'll want to repeat it. Honestly, you could do this every day. It only takes a few minutes until you do start to feel better. And then I would recommend doing this either before or after your run, every time that you've run. It's not ever a bad idea to just make it part of your warm-up or your cool down, whatever really works good for you. If you've been experiencing pain, I would definitely do it before. If it's more of just a preventative, I would do it after as part of your stretching and stuff. You can also just glide the muscle. We don't even need any lotion right now. But basically, you can do that for the lateralis. This is a huge muscle that causes pain here. Now you can do the same exact thing for the rectus femoris. It also has a trigger point that is pretty close to your crease right here. Now the medialis is a little more medial. You want to be careful with this one. You don't want to go into the inner thigh, because there are some important blood vessels that you just don't want to damage. But the same thing, you can work down, you know, from the top to the bottom. Now you can also work around your knee. It's okay to touch your knee and touch tendons and ligaments. You're not going to hurt anything unless you have an actual damage here. As long as you're healthy and, you know, there's no actual tear or anything in the tendon or the joint, you can certainly manipulate it. And actually, if you have torn it, once it heals, then you can do the same thing. So your kneecap should move pretty well side to side. Usually one side moves a little bit more than the other, so you can do that. You can, you know, just do some cross fiber friction along the tendon. And this can be kind of sensitive. If you have this anterior knee pain, what you can also do is kind of move the patella upward and go under, and just be careful there. But this is your patellar tendon or your triceps tendon. It kind of is interchanged there. So you can work that. You can go onto each side. This tissue just gets really restricted over time and from overuse. And do that the same thing on the inside of the kneecap. Again, not on the inside of the knee, but just where your patella is. So you can work all of that as well and stretch. I recommend warming it up, do the specific muscle work, and then stretch. That is key. If stretching a muscle that is too tight to be stretched is not going to help anything. But once it's released and then stretching it, you're reminding it of its normal resting length, and that is going to be super helpful. I hope this video was helpful. Please let me know if you have any questions about anything, and let me know if you have any other areas of pain or tension that are bothering you that you would like me to speak more of, maybe create a video about. I would totally love to help you out with that. Now, some other things to consider in addition to what we were talking about today is making sure that you're getting enough water. Hydration is so important with overall health, but definitely with exercise and overworking these muscles. You need the proper rest. So you should not be running 5 miles a day. You have got to take some time off and listen to your body. Plus, rest as in getting a good quality night's sleep is going to help too, because it's going to allow you to really recuperate. And I hope you have an awesome day. Thank you so much, and I will see you in the next one. Go do something good for yourself now, like self-massage. Bye.